Want to see your brand on TV? Roku Ads Manager makes it easy to launch targeted ad campaigns in minutes, track results in real time, and drive on-screen purchases with just a click of the Roku remote. Get a $500 match on your first $500 spent with code ROKU500 at ads.roku.com. That's code ROKU 500 at ads.roku.com. Terms apply.
Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, saving the bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai in her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now and tune in for a variety of great guests and topics. Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Hello everyone, Chris here from MedPrep2Go, and welcome to our USMLE Step 1 Questions podcast. I'll be your reader for today, and in this episode, we are going to read 3 neurology questions from our online qbank. Friendly reminder that you can go read all of these questions and more at medprep2go.com. So with that being said, let's get into it with question 1, Neurology 4. A 50-year-old man comes into the clinic complaining of trembling in his hands, which has been worsening over the last 5 years. He reports that the trembling decreases when he drinks a glass of wine at night. His father and brother have similar tremors. On physical examination, he has a high-frequency, bilateral tremor when he extends his hand to reach for an object. No other neurologic signs are noted. He is prescribed propranolol, which improves his symptoms. Which of the following is the most likely diagnosis? A. Dystonia. B. Essential tremor. C. Hemiballismus. D. Intention tremor. Or E. Parkinson's disease. The correct answer is B. Essential tremor. Essential tremor classically involves the hands and is brought out by arm movement and sustained anti-gravity postures. The tremor is absent when the affected body part is completely relaxed and supported against gravity. Essential tremor tends to be slowly progressive and affects activities such as writing and drinking from a glass. It can also involve the head, voice, and uncommonly the legs. Essential tremor is typically bilateral, involves an action tremor, is moderate to high in frequency, does not have other neurologic signs present, and is typically relieved by small amounts of alcohol. The most effective treatments are propranolol or primidone. Answer choice A, dystonia, is incorrect. Dystonia is characterized by involuntary sustained muscle contractions that result in jerky movements. Answer choice C, hemiballismus, is incorrect. Hemiballismus occurs when there is a lesion in the subthalamic nucleus. This is marked by sudden, flailing movements in the contralateral arm and leg. Answer choice D, intention tremor, is incorrect. Intention tremor is due to a cerebellar defect and is characterized by a slow, large amplitude tremor when pointing at a target. It would not improve with alcohol or propranolol. Answer choice E, Parkinson's disease, is incorrect. The tremor of Parkinson's disease is a resting, pill-rolling tremor that is relieved with movement. Key learning point. Essential tremor is the most common adult movement disorder. Essential tremor classically involves the hands and is brought out by arm movement and sustained anti-gravity postures. The tremor is absent when the affected body part is completely relaxed and supported against gravity. Other neurologic signs are absent. Question 2, Neurology 5. A 60-year-old man presents to the emergency department because 1 hour ago he suddenly became very dizzy, started vomiting, and then fell on his left side. He states that his arm and leg just aren't working properly. His history is significant for hypertension, for which he is prescribed lisinopril, but only takes when his wife reminds him. Physical examination reveals that the left side of his face is drooping and he cannot raise his eyebrows. Examination of the eyes reveals that he has nystagmus in the left eye and his left pupil is dilated with drooping of the lid. Pain sensation is absent on the left side of his face and in the right extremities. During the examination, he asks for questions to be repeated and states that his left ear stopped working at the onset on the rest of his symptoms. Which of the following arteries is occluded? Is it A, anterior inferior cerebellar artery, AICA, B, distal basilar artery, C, lenticulostriate artery, D, middle upper basilar artery, or E, posterior inferior cerebellar artery, PICA. And the correct answer is A, anterior inferior cerebellar artery, AICA. Occlusion of this artery causes lateral pontine syndrome, one of the brainstem stroke syndromes of the lateral aspect of the pons. It is characterized by sudden onset of vertigo, nausea and vomiting, and falling to the side of the lesion, vestibular nuclei, as well as ipsilateral hearing loss, cochlear nuclei, facial weakness, facial nucleus and nerve, loss of pain and temperature to the face, spinal trigeminal nucleus and tract, and limb and gait ataxia, middle/inferior cerebellar peduncles. Contralateral loss of pain and temperature sensation to the extremities from the lateral spinothalamic tract also occurs. Horner syndrome is common due to damage of the descending sympathetic tract. Overall, when thinking of lateral pontine syndrome, think of someone with sudden onset vertigo, nausea, vomiting, and falling to the side of the lesion, as well as ipsilateral facial weakness and numbness and contralateral body loss of pain and temperature sensation. Answer choice B, distal basilar artery, is incorrect. Occlusion of the distal basilar artery causes top of the basilar syndrome, also known as rostral brainstem infarction. This damages the thalamus, hippocampus, and occipital lobes. It presents with visual, pupillary, and oculomotor issues and changes in mental status. Answer choice C, lenticulostriate artery, is incorrect. Occlusion of the lenticulostriate artery stroke is a type of lacunar infarct. Lenticulostriate arteries are small, deep penetrating branches of the middle cerebral artery, MCA, that supply the basal ganglia and internal capsule. It usually presents with contralateral hemiparesis, slurred speech, and upward gaze deviation with attempted lateral gaze. Answer choice D, middle upper basilar artery, is incorrect. Occlusion of this artery causes infarct of the upper ventral pons and is known as locked-in syndrome. It presents with quadriplegia. Patients are unable to move, speak, look laterally, or make facial movements. However, consciousness is maintained along with vertical eye movements and blinking. Answer choice E, posterior inferior cerebellar artery, PICA, is incorrect. Occlusion of this artery causes Wallenberg syndrome, also known as lateral medullary syndrome. It presents with ipsilateral Horner syndrome, loss of pain and temperature sensation to the face, hearing loss, vertigo, ataxia, nausea, vomiting, hoarseness, and dysphagia. It also includes contralateral loss of pain and temperature sensation to the trunk and extremities. While very similar, lateral pontine syndrome does not present with hoarseness or dysphagia. Key learning point. Occlusion of the anterior inferior cerebellar artery, AICA, causes lateral pontine syndrome and results in vertigo, nausea, vomiting, and falling to the side of the lesion, as well as ipsilateral facial weakness and numbness and contralateral body loss of pain and temperature sensation. Question 3, Neurology 6. A 74-year-old woman is brought to the clinic by her daughter because of progressive memory loss over the past year, and occasionally gets lost in familiar surroundings. She has also had increased difficulty managing her finances and preparing meals. The patient denies any hallucinations, delusions, or depressive symptoms. There is no history of seizures, head trauma, or substance use. She denies urinary incontinence. Medical history includes hypertension and hyperlipidemia. Her medications include lisinopril and atorvastatin. Family history is notable for her mother having had senile dementia. She is a retired school teacher and does not smoke cigarettes or drink alcohol. Vital signs are within normal limits. On mental status examination, she is alert but disoriented to date. She is unable to recall 3 out of 3 objects after 5 minutes, even with cues. Her speech is fluent and there are no motor or sensory deficits. Her score on the Mini Mental State Examination, MMSE, is 21 of 30, with impairments in recall and orientation. Which of the following is the most likely diagnosis? A. Alzheimer's dementia. B. Frontotemporal dementia. C. Lewy body dementia. D. Normal pressure hydrocephalus. Or E. Vascular dementia. And the correct answer is A. Alzheimer's dementia. This elderly woman presents with insidious progressive memory impairment and difficulty performing instrumental activities of daily living, for example, finances and cooking, which are characteristic of Alzheimer's disease. Her deficits in orientation and recall, as well as her MMSE score, 21 of 30, indicate mild to moderate cognitive impairment. Alzheimer's disease typically begins with early anterograde memory loss, followed by impairments in executive function and language. Risk factors include advanced age, family history, and cardiovascular comorbidities. Answer choice B, frontotemporal dementia, is incorrect. Frontotemporal dementia often presents earlier, in the 50s and 60s, and is characterized by prominent behavioral changes or language deficits, for example, apathy, disinhibition, or compulsive behaviors, with relative preservation of memory in the early stages. This patient's presentation of early memory impairment with no personality changes argues against this diagnosis. Answer choice C, Lewy body dementia, is incorrect. Lewy body dementia is characterized by visual hallucinations, fluctuating cognition, REM sleep behavior disorder, and Parkinsonism. Although it may overlap with Alzheimer's dementia, the absence of hallucinations and extrapyramidal signs makes this less likely. Answer choice D, normal pressure hydrocephalus, is incorrect. Normal pressure hydrocephalus presents with the classic triad of gait disturbance, urinary incontinence, and dementia. Wet, wobbly, and wacky. This patient's predominant symptom is memory loss without any incontinence or mention of gait instability, making NPH unlikely. Answer choice E, vascular dementia, is incorrect. Vascular dementia typically follows a stepwise progression associated with cerebrovascular events and may present with focal neurologic findings. Risk factors include hypertension and stroke history. This patient has cardiac risk factors, but lacks evidence of a stepwise decline or focal deficits, making Alzheimer's dementia more likely. Key learning point. Alzheimer's dementia is the most common cause of dementia and presents with gradual, progressive memory loss, particularly affecting recent memory and executive function. Early diagnosis is based on clinical features and exclusion of other causes. Risk factors include advanced age and family history. And that will conclude this episode of our Step 1 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can keep learning and read other Step 1 questions at medprep2go.com. Happy studying! Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 Questions podcast combined and ad-free. You'll also get early access to all of our Step 2 Questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com.